Dear students, good morning. Let's start our pathanatomy lecture. You hear me? Write me, please. You hear me? Dear students, write me in chat, please. You hear me? Dear students, please answer, you hear me or not? Students, please answer, you hear me or not? Thank you. Well, let's start. Today, our topic, general doctrine about inflammation, general information about inflammation, and exudative inflammation. Exudative inflammation. What is inflammation? Inflammation is a complex stroma vascular response to injury aimed at eliminating the injurious agent, and the restorations of damaged tissue. Complex stomavascular response to injury aimed at eliminating the injurious agent and the restorations of damaged tissue. It is evolutionary developed protective reactions. Aimed at removing foreign agents. Inflammation is a physiological response to damage. Protective, adaptive reactions aimed at delimitations of area of damage, and localizations, areas of damage, destructions of agents that cause inflammation, and restorations of damaged tissue, repair. Repair. Etiology of inflammation. Just biological factors, bacteria, immune factors, antibodies, immune complexes, physical factors, radiation, for example, temperature, high and low temperature, injury, mechanical factors, chemical factors maybe, chemical factors, drugs, toxins, poisons, chemical factors. Other etiological factors, it is tissue necrosis of any origin, tissue necrosis of any origin, different foreign bodies, and immune reactions. Classifications are inflammatory reactions, classifications of inflammations due to etiology. Include specific type and non-specific type inflammation. Specific inflammations caused by certain factors, pathogens. For example, Mycobacterium tuberculosis, leprosy, syphilis, actinomycosis. Just specific inflammations and inflammation, and non-specific inflammation caused by other biological factors. For example, like Escherichia coli, and maybe physical or chemical factors. Specific and non-specific inflammation. Next, classifications of inflammations according to durations. According to by time. Acute, subacute inflammations and chronic inflammations. Acute inflammations, the form of inflammatory response, acute inflammations, form of inflammatory response that develops immediately after exposure to damaging agent. And characterized by predominance, exudative tissue reactions. And rapid completion of a process with eliminations of damaging agent. Rapid completions of a process with elimination of damaging agent and repair of tissue. Durations 7 to 10 days. Subacute inflammation characterized by duration between acute and chronic. Chronic inflammations is a long process, 6 months and more, with tissue damage, reactive change, and processes of healing, scarring, and characteristics are periods of exacerbations and replaced by remissions. Periods and remissions periods. Signs of inflammations. Signs of inflammation include rise of the temperature, fever, or color, Latin term, color. Redness over inflammatory focus, redness over inflammatory focus, rubor, rubor. Redness or hyperemia, redness or hyperemia, rubor. Next, swelling of inflammatory focus, swelling or edema, swelling or edema of inflammatory focus, tumor, Latin term, tumor. Next, signs, pain, pain due to the damage of the nerve endings, pain, Latin terms, dolor. And loss of functions, loss of functions, functional leisure, functional leisure. Just all typical signs of inflammation. Heart, increase temperature, redness or hyperemia, swelling or edema, pain, and loss of functions. Next, general signs of inflammation. General signs of inflammation. General signs include general signs are just clinical signs and signs in the blood. Fever, general signs, just fever, and in the blood change. Leukocytosis, leukocytosis, increase in the number of white blood cells in the peripheral blood. Leukocytosis. Next, increased erythrocytes segmentation rate. Increased erythrocytes segmentation rate. And change in the protein and enzyme spectrum of the blood. Change in the protein and enzyme spectrum of the blood. Just general signs. Next, pathogenesis. Let's talk about pathogenesis. Pathogenesis or morphogenesis of inflammations. Just morphological signs. Morphological signs or stage. Inflammation include three main stages: alteration, exudation, and proliferation. Alteration, exudations, and proliferations. Alteration. Alterations. Damage to the structure of the cells. Alteration. Damage to the structure of cells, tissue, and organs. Damage to the structure of cells, tissue, and organs, accompanied by violations of their function. Accompanied by a violation of their function. Dystrophy and necrosis. Violations of their functions and violations of the structure. Dystrophy and necrosis. And accompanied by release of bioactive substance. Accompanied by release of bioactive substance. Mediators of inflammations. Mediators of inflammations. Alteration include primary and secondary type. Primary and secondary type. Primary alterations occurs in response to a direct effect of an inflammatory factor and prolongs its pathogenic effects. Primary alterations occurs in response to a direct effect of inflammatory factors and prolongs its pathogenic effect. And secondary alterations occurs under the influence of various pathogenic factors. It may be local factors, for example, physical and chemical, inflammation mediators, vascular reactions, just local factors, and maybe systemic factors, systemic change, nervous, humoral, endocrine, immune reactions. Mediators of inflammations include plasma mediators and cells mediators. Plasma mediators, just coagulations and anticoagulation systems, kinin systems, and complement system. And cell mediators, it is different inflammatory cells, basophils, histamine, serotonin, heparin, thrombocytes, endotheliocytes, neutrophils, lymphocytes, and monocytes. Effects of mediators include vasodilatation, increased vascular permeability, next hematoxis, and migrations of leukocytes and their activation, fever, pain, and damaged tissue. Next stage of inflammation, exudation. Exudation is a reaction of microvasculature. With change of the rheological properties of blood. Reactions of microvasculature with change of the rheological properties of blood. Symptoms of increased vascular permeability, phagocytosis, and formations of exudate. The following processes are the basis of exudation. It is change in blood flow and caliber of vessels. Vasodilatation, opening of new capillaries, and increased blood flow. Clinical signs, redness and fever. Next, increase in the permeability of blood vessels, and passage from the blood of a liquid part of the blood, passage from the blood of the liquid part of the blood, just edema, and passage proteins. Next, increase blood viscosity, and stasis and maybe thrombosis. And finally, in exudation appear migrations of cells, especially neutrophils, through the vascular wall into the interstitial tissue. Neutrophils, migrations of cells through the vascular wall into the interstitial tissue. Focus of inflammation, exudative stage, you can see in the slide. Inflammatory hyperemia, and swelling of the skin, and marginal stains leukocytes. The serous type of inflammation, with formations of bubble on the skin. Migrations of leukocytes to focus of inflammations, phagocytosis, and release of proteolytic enzymes. Cells in the areas of acute inflammations, cells in the zone of acute inflammations appear in different time. At first appear neutrophils in the focus of inflammation. Time for appear neutrophils 6 and 24 hours. After neutrophils appear monocytes, neutrophils replaced by monocytes. After 24 and 48 hours appear monocytes, and when monocytes replaced by macrophages. Monocytes differentiate into macrophages. Next stage, final stage, proliferative stage. Just finally phase of inflammation, providing reparative tissue regeneration, at a site of alteration. Final phase of inflammations providing reparative tissue regenerations at the site of alteration. Proliferation process characterized by proliferations of inflammatory cells, such as macrophages, Campbell mesenchymal cells, smooth muscle cells, and epithelium. Proliferations of inflammatory cells. macrophages, Campbell mesenchymal cells, smooth muscle cells, and epithelium. Proliferation. Next, differentiations and cell transformation. Differentiations and cell transformation. Macrophages can be transformed into epithelioid and giant cells. Macrophages transform into epithelioid and giant cells. B lymphocytes transform into plasma cells. B lymphocytes transform into plasma cells, and Campbell mesenchymal cells transform into fibroblasts. Campbell mesenchymal cells transform into fibroblasts. Cell proliferations in the area of inflammation with the appearance of a lot of fibroblasts is used to repair damaged tissue. The main signs of proliferative stage are just repair damaged tissue, and delimit the inflammatory focus. Next questions. Morphological types of inflammation. Types of inflammation include 3 variants. According to the stage of inflammations, and accompanied by stage of inflammation, which is alterative inflammation, exudative inflammation, and productive or proliferative inflammation. Alterative inflammations characterized by the prevalence of degenerations and necrosis lesions. Alterative inflammation characterized by the prevalence of process destroy, degeneration, and necrosis. Exudative inflammation. Inflammations with predominance of exudation process. Mainly acute inflammation. And productive proliferative inflammation. Inflammation with predominance of proliferation phase. Mainly chronic inflammation. Exudative inflammation characterized by a predominance of exudation and formations of cavities in the tissue with presence of exudate. Predominance of exudation phase and formations of cavities in the tissue with the presence of exudate. What is exudate? Exudate is a muddy fluid consist proteins more than 2%, and gematogen cells inflammatory nature. inflammatory nature, which exits from the small blood vessels in the site of inflammation. Exudate composition: fluid, proteins, fluid, it is a plasma fluid, proteins. Next, blood uniform elements, inflammatory cells, cells of local tissue, lysis products, and microbes. Exudative inflammation include 7 forms. By according to the type of exudate, there are serous inflammation, fibrinous inflammations, divided to groups, and diphtheric, Next, purulent inflammation, hemorrhagic, catarrhal, putrid, and mixed form. Serous inflammation, characterized by formations of exudate containing up to % protein and a small number of cells. Exudate with serous inflammation contain up to 2% protein and a small number of cells. Localization. It is serous membranes, for example, with rheumatic disease, polyserositis, inflammations in serous cavities, polyserositis, and with uremia and outer intoxications, damage serous membranes. Damage and inflammations in serous membranes appear. Next, localizations: mucous membranes, and skin. For example, herpes virus infections, burns, and bullous eryspils. And next localization: internal organs. For example, serous pneumonia with influenza. Rheological factors or causes. Just thermal and chemical factors. For example, burns or frostbite in the bullous stage. Next, viruses, herpes, bacteria, for example, Mycobacterium tuberculosis, meningococcus, and rickettsia. Next, allergens of plant and animal origin, and auto-intoxications with thyrotoxicosis or uremia. Auto-intoxication. Morphological signs. Morphological signs. Formation serous exudate, the slightly cloudy and straw yellow liquid. Serous exudate, it is liquid, slightly cloudy and straw yellow color. Outcome. Favorable. Resorptions of exudate. But sometimes maybe complications. For example, in the heart, accumulations on inflammatory serous exudate in the heart with formations heart shot. Effusions, complications, the work of the heart, and accumulations serous exudate in the pleural cavity leads to compressions of the lung. Serous inflammations you can see in the slide. Change in the skin, hyperemic, focus of hyperemia, edema, and painful. And serous inflammations, focus of accumulations of serous exudate, vesicular, in form of vesicular bubbles with fluid. Next type of inflammation is fibrinous inflammation. Exudate contains a large amount of fibrin. Which is formed from fibrinogen. Etiological factors: infection disease, for example, Croup pneumonia, diphtheria, dysentery, tuberculosis. Infections allergic to disease, rheumatism, and outer intoxication, uremia, Localizations of a fibrinous inflammation are mucous membranes or serous membranes. Mucous membranes and serous membranes. The formation films on the mucous and serous membranes. Formation films. There are two types of fibrinous inflammation. Fibrinous inflammations include two types: Croup and diphtheric inflammation. Signs for Croup inflammation: develops on the serous membranes, as well as the mucous membranes covered with a cylindrical epithelium. Mucous localizations: serous membranes or mucous membranes covered with a cylindric epithelium. Fibrinous film is a thin, loosely bound to the underlying tissue. and easily rejected, loosely bound to the underlying tissue, and that's why easily rejected. Next variance of fibrinous inflammations, it is diphtheric inflammation. Diphtheric inflammation develops with deep tissue necrosis. Deep tissue necrosis. In corpus inflammations, only superficial necrosis. In diphtheric inflammations, always deep necrosis, deep tissue necrosis, and impregnations of a necrotic mass with fibrin. Impregnations of necrotic masses with fibrin. Localization. Mucous membranes covered with squamous epithelium. Mucous membranes covered with squamous epithelium. Where maybe oral cavity, pharynx, tonsils, epiglottis, esophagus, true vocal cords, and cervix. Mucous membranes covered with squamous epithelium. Morphological signs. Fibrinous film formation. Fibrinous film is firmly soldered to the underlying tissue. Firmly soldered to the underlying tissue. When it is rejected, formation deep defect formation. Deep defect, ulcers and hemorrhage. After diphtheric inflammation. You can see in the slide corpus inflammations and on the trachea, corpus inflammation with films, and fibrinous film on the surface of the mucosa. Corpus type of inflammations and fibrinous type. For example, in this slide, fibrinous pericarditis. Formations, fibrinous films in the surface of the heart. And corpus pneumonia. Focus of formations of fibrinous films. Focus of inflammation with coverage of a film. And microscopically change lumens of alveoli contain fibrin and leukocytes. In the lumen contain fibrin and leukocytes. And fibrinous films on the pleural surface. Pseudomembranous colitis. Next examples for diphtheric inflammation. Pseudomembranous colitis on the surface of the intestine. Formation diphtheric films and microscopically change. Next form of inflammation is purulent inflammation. Purulent inflammation characterized by predominance of neutrophils in the exudate. Which together with the liquid part, formations exudate, form pus. Exudate, pus. Pus also includes lymphocytes, macrophages, necrotic cells of local tissue, and pyogenic microbes. Pyogenic microbes may be Staphylococcus aureus, Streptococcus pyogenes, Neisseria gonorrhea, Neisseria meningitis, Escherichia coli, and other gram-negative bacilli. It is pyogenic microbes or etiological factors for purulent inflammation. Etiological factors, pyogenic microbes, especially Staphylococcus and Streptococcus. Types of purulent inflammation. There are phlegmon, abscess, and empyema. Phlegmon. What is phlegmon? Phlegmon, it is diffuse purulent inflammation. Diffuse purulent inflammation. Most often occurs in the subcutaneous tissue. Subcutaneous localization. Subcutaneous tissue. In the fascia, along the neurovascular bundles. In the fascia localization, subcutaneous tissue, fascia, along the neurovascular bundles. Phlegmon, it is diffuse purulent inflammation. Next form, abscess. This is purulent inflammation with tissue melting and cavity formation. And next form, empyema. Purulent inflammation with accumulation of pus is enclosed or poorly drained cavities. Accumulations of pus in enclosed or poorly drained cavities. For example, accumulations of pus in the pleural, pericardial, or peritoneal cavities. Accumulation of pus in the cavities, pleural, pericardial, or peritoneal cavities. Purulent form of inflammations in salpingitis. You can see focus of inflammatory contains mainly inflammatory cells, especially neutrophils. Phlegmonous appendicitis and phlegmons of soft tissue over breasts. accumulations of the past in the breast. Abscess and complications of pneumonia. Abscess, it is walls, formations of a cavity with pus, infiltrated with fibrin and leukocytes. Focus of cavity. Represented by necrotic masses and surrounding lung tissue compacted, infiltrated by fibrin and leukocytes. And chronic abscess. Localizations: brain. Chronic abscess: macro change and microscopically. In chronic abscess formation capsule with a free ledge structure, necrotic masses, then granulation tissue, pyogenic membrane, and fibrous tissue. Just signs for chronic abscess. Empyema, purulent inflammations of the walls, cavities with accumulations of pus. Next form, inflammation, hemorrhagic inflammation. Characterized by formation of exudate, represent mainly by erythrocytes, red blood cells. Formation exudate, represent mainly by red blood cells, erythrocytes in the exudate. Contain mainly erythrocytes. Mechanism of development: a sharp increase in the permeability of microvessels. Sharp increase in the permeability of microvessels and pronounced erythrodiapedesis. Causes: severe infection disease, influenza, anthrax, vitamin C deficiency, and maybe hematopoietic organs pathology. Localization, skin, mucous membranes of the upper respiratory tract. Mucous membranes of the upper respiratory tract. Gastrointestinal tract, lungs, and lymph nodes. Hemorrhagic inflammations in the brain. Macro focus of accumulations of hemorrhage, accumulations of erythrocytes, and microscopically contain exudate content of erythrocytes with other cells inflammatory. Next form, inflammation, catarrhal inflammation. localization mucous membranes, exudate formation, exudate which flows from the surface, characterized catarrhal inflammation characterized by abundance of exudate that flows from the surface. Exudate contains mucus. Exudate contains mucus always. It can be serous, purulent, and mucus. Can be serous, purulent, and mucus. Etiological factors for catarrhal inflammation include infection disease, name pathology catarrh of the upper respiratory tract in acute respiratory infections, catarrh, and allergic reactions, allergic conditions. Outcome favorable, complete restoration of the mucous membrane, But sometimes catarrhal inflammation can take a chronic course, and chronic course accompanied by restructuring of the mucous membranes and its atrophy. Atrophy of the mucous membranes, it has complications and unfavorable outcomes for catarrhal inflammation. Catarrhal inflammations in the lung, you can see in the slide. Exudate contain a lot of mucus. Macro change and microscopically. Next form inflammation, putrid inflammation. Etiological factors: Clostridial anaerobic infection, Clostridia perfringens, Clostridium novio, and Clostridium septicum. Clostridial anaerobic infection pathogens. Localization. Wounds with extensive crush injuries. Morphological change. Wound edges are cyanotic color. In the focus of putrid inflammation, cyanotic color. Swelling of subcutaneous adipose tissue. Swelling of the subcutaneous adipose tissue. Swelling and pale, and sometimes formation necrotic masses in the muscle tissue. Necrosis in the muscle tissue. On palpation, can be crepitating sound, crepitating, and wound has an unpleasant smell. Wound has an unpleasant smell. Outcome unfavorable. Outcome unfavorable. This is massive destructions, massive destruction, massive destructions of a tissue, and reduce resistance of the organism. Reduced resistance of organism, massive destructions of the tissue, reduced resistance of the organism, and maybe sepsis, general infections, sepsis. Next questions. Outcome of acute inflammation. Outcome of all form acute inflammation. Recovering is the reverse development. Recovering, regeneration. Next, healing with scarring tissue formation, just incomplete regeneration, scarring tissue. Next, transition into purulent inflammation, and transition to chronic inflammation. This outcome. That's all, students. Today our lecture is finished. Thank you for your presence and thank you for your attention. Goodbye and see you. Good luck.